are going to give this talk together. So we were asked to provide a presentation on the Nemours Cardiac Center for Cardiovascular Research and Innovation. And so I'll let Erica take on the first couple slides.
Yeah, so hi everyone, thanks for listening. So I just wanted to provide a brief overview of the Nemours Cardiac Center for those of you who are not familiar with this center within Nemours. So the Nemours Cardiac Center has been around for over 20 years, and it is a multidisciplinary center within Nemours Children's Health. So there is, it's a large center that incorporates many different disciplines, all within kind of the same umbrella. So that includes cardiologists, surgeons, intensivists, nursing, psychology. I could go on and on, but there's many genetics, nutrition. We provide all different types of care for patients with congenital and acquired heart conditions. And so, although we are primarily a pediatric center, we do provide care starting before birth through the fetal cardiology program. So expectant parents who get a diagnosis of congenital heart disease around 20 weeks gestation would come into the Nemours Cardiac Center and actually be followed through the fetal cardiology program until the baby's born. And then the baby would receive care, inpatient care. We have 2 inpatient units, a cardiac intensive care unit, as well as a step down unit. And then there's also, ORs and cath lab and then outpatient clinic that also includes multiple satellite clinics. And then we provide care for those with complex CHD, CHD meaning congenital heart disease, up until age 40 through the adult congenital heart disease program. So as you can see, it's a large program that really does span from, the fetus up to adulthood. Next slide. So the CCRI, which is the Center for Cardiovascular Research and Innovation within the Nemours Cardiac Center, was developed about a year ago. And the mission is to promote multidisciplinary, collaborative, and leading-edge clinical, translational, and basic science research across a diverse spectrum of research areas, leading to advancements in knowledge and improvement in clinical care and outcomes. So we have been doing research in the Nemours Cardiac Center, as long as the Nemours Cardiac Center has been around, but the goal of the CCRI is really to bring it together under one umbrella, under the CCRI, the Center for Cardiovascular Research and Innovation, and to kind of be able to, obtain more resources to support research within the center, as well as collaborations. Next slide.
So with regard to the CCRI, we have a set of research areas of focus, everything from CT surgery and imaging, including fetal and 3D imaging. We span through, so that's congenital, but also into prevention, so cardiovascular disease prevention and social determinants of health. There are researchers in our program who focus on neurodevelopmental outcomes, including Dr. Sood, and artificial intelligence, as well as data science, analytics, critical care, and advanced support technologies for heart failure. And we do have an active transplant program, but the research centers on topics related to critical care and ECMO and ventricular assist device support. In terms of the CCRI and its function within the larger Delaware and Nemours community, there are a number, as we know on the call, there are a number of other research programs within Nemours and within the state of Delaware. And our goal is really to work collaboratively in leveraging resources for those within the cardiac center interested in research, but also to expand and with outreach and overlapping, sort of allowing for researchers with overlapping interests to collaborate. And so we're aware for the Excel program, the Center for Healthcare Delivery Science, Embry, Cobry, the University of Delaware, Thomas Jefferson, and our various cores, including Community Engagement Corps, the VBSO, which is a value-based service organization. And then, of course, additional external funding to the state of Delaware and to Nemours, which would be working with researchers funded through the NIH and AHRQ. And then ultimately, research is obviously there's different types and different arms, and there's the research that's ongoing now, but we wanted our program to be a program that focuses on innovation. So what's coming next? And so we do have researchers within our program that are interested and actively involved in artificial intelligence, as well as data analytics, bioinformatics, this idea of simulated clinical trials and big data, which obviously relates to the data analytics and bioinformatics. In terms of our current research areas, and we have area leads for these different programs. So for cardiovascular surgery, it's Dr. Christian Pajaro, who is our lead surgeon for Nemours Cardiac Center, and also co-director of the Nemours Cardiac Center. Neurodevelopmental and psychosocial research, Dr. Sood. Advanced imaging and artificial intelligence, Dr. Shrivastava and Mark Kurtowski. Data science, big data and causal inference related to preventive cardiology, myself. And we also have an active program in preventive cardiology and looking at social determinants of health and impact on development of risk factors, and as well as implementation science component that Abbas Zaidi is involved in. And then cardiovascular genetics and genomics, as well as cardio-oncology and exercise. COVID, we have a number of active projects related to COVID, research utilization, quality improvement, and then what got caught off at the bottom is the cardiac intensive care research that we have studies that are actively ongoing.
So, in terms of our activities, we do have and are continuing to work towards additional external and internal grant funding. So we've had over $1 million in funding in 2 years. We have a monthly research meeting, and this is focused on different topics that are, relevant or of interest to our cardiac center with regard to research. So this might be researchers from within the Nemours Cardiac Center presenting on their research. This might be bringing folks in from outside the Nemours Cardiac Center, whether other departments in Nemours or other places within the state of Delaware, to talk about research. And that really helps to stimulate collaborations. We also have, opportunities for junior faculty or trainees to practice presentations that they'll be giving at national conferences. We have a monthly research newsletter, and the goal of this is really to have all of the resources in one place. So we list, upcoming grant deadlines, upcoming abstract deadlines, different, conferences or trainings that are relevant, the list of, publications and presentations for the Nemours Cardiac Center. We are working on a series of educational lectures, and the goal is really for these to be brief virtual lectures that can be recorded and stored for fellows and junior faculty to be able to access on various topics, including statistics. We have a team of cardiac research coordinators that are the manager is Carol Prospero, and this is something that has grown over the last couple of years. I think we have 3 cardiac research coordinators now. Correct me if I'm wrong, Carissa and Carol, if it's more than 3, but I believe it's 3. We also have involvement in fellows, residents, and students. So we have cardiac fellows within the Nemours Cardiac Center, and they all do, one or more research projects. But we've also had the opportunity to bring in residents, so often, medical residents, peds residents, as well as students from Jefferson or UD. We are expanding to include a data scientist and statistician. We're actively hiring for this position. And then, of course, leveraging collaborations outside of the CCRI or outside of the Nemours Cardiac Center. So, for example, there are already resources available for mock peer review, through Excel. So that's something that we can, leverage without having to duplicate that service. Mentorship, sponsorship. So many times mentors are outside of the CCRI. So for example, someone from the Center for Healthcare Delivery Science may serve as a mentor. Research symposia, design sessions, statistical support, accessing statistical support through the BIRD core, and then community and family partnerships. So again, collaborating with the community engagement core of Excel, as well as some of the resources that are now going to be available through the new Nemours Cobry, the Reach Center. Next slide. So, the goal of today's presentation is really just to let you all know about CCRI, but also to think a little bit about opportunities for collaboration. So, of course, we are very open to and excited about research collaborations on grants and studies. So if folks on this call or anyone is interested in collaborating, with one of our investigators, you can always reach out to myself or Carissa, and we can help to connect you. Or, of course, you can reach out to the investigator themselves. Sharing your work at monthly cardiac research meetings. So we're always looking for opportunities to hear about, research that's going on in the state of Delaware, outside of Nemours or at other departments within Nemours. And would love to have you, present your works, and we can talk more about collaborations in that setting. So please, contact Carissa or I if you're interested in potentially presenting at our monthly cardiac research meeting, or we may reach out to you if we, learn about your work and we feel like it's relevant to potential collaborations. Send us relevant resources or collaborative opportunities for our newsletter. We do have a cardiac newsletter that goes out to our entire cardiac center, as well as other folks that are interested in receiving it once a month. And, if there are opportunities for trainings at your institution or potential opportunities for collaboration, we can always include those in the newsletter. And if you're interested in receiving the newsletter, just let us know and we can put you on the list. Similarly, if you're interested in attending the monthly cardiac research meetings, we can also invite you. So you just have to reach out to us and let us know. And then educational lectures. So right now, like I said, we're working on a series of educational lectures that will be virtual and archived so that they can be accessed at any time. And so, there may be an opportunity to bring in folks, from other departments or other institutions that have expertise that we don't have, and vice versa. And we're always happy, of course, to do the same for your departments. And I think there's other opportunities for collaboration as well. So we'd love to hear other ideas if folks have them. Next slide.
Perfect. So thank you, Erica. So just lastly, this is our last slide. I just wanted to, or we wanted to just kind of go over where we sort of see the CCRI going. And obviously this is a work in progress, but, right now, as Erica sort of highlighted, initially before the formation of the CCRI, there was definitely research ongoing within the cardiac center. Much of it was unfunded. And so we really have made an effort over the last few years to increase the amount of funded research. And obviously, it's wonderful. We have a lot of internal funding that people have been able to secure, but we would like to expand our sort of portfolio of external funding for lots of reasons. And also within that, having the opportunity to expand external funding also means being able to, maybe have T32 funding for fellows, as well as, offer maybe administrative supplemental grants for R1 funded providers to researchers to, incoming junior faculty or fellows to participate in. And again, sort of expanding the number of funded cardiologists, pediatric cardiologists. And then the other area that that I listed under funding is maybe not so much directly related to funding, but more of administrative, is just having a closer relationship with like the OSP office and accounting, and making sure that there's a seamless sort of communication between those departments, making it easier for researchers to kind of not have to focus so much on the administrative aspects of their grant applications, and really be able to kind of turn that over to someone else to help with the management, particularly when the grants are funded and there's budget and contracts and all of that. Really having that sort of nice and laid out and secured. Expansion of staff. We're very glad that we have a number of very good research coordinators. And when you have good coordinators, it means they're good at lots of things. And we have one that's going to pursue his PhD. So right now we have about 2.5 in terms of research coordinators available to us, but we are expanding that hopefully soon. And then, as Erica mentioned, we're actively interviewing and recruiting a data scientist / statistician for the program, because of our vision of expanding research in the areas of data science and big data and artificial intelligence, machine learning. And then, ultimately, it's not to remain small. We would like to seek some more national preeminence with regard to the type of research that we carry out, as well as the program itself. So that means having the program, acknowledged national presentations and publications and the like. Really want to get our website up and going to help with not only just communication about the program, but also the active research that's happening within the program, and making it more interactive so that people can collaborate, connect to collaborate much more easily. And then it's clear to the public, the terrific work that's coming out of the projects that have been funded and the researchers that are leading those projects. And then collaboration is essential, and we would like to see that expand with existing research programs within Nemours and state of Delaware and elsewhere. And then finally, as we expand the program, obviously the areas of focus will expand as well. And so we look forward to in these next 10 years seeing an expansion of the topics and the areas of focus that we cover within the CCRI. So with that, I'll stop, and Eric and I are happy to take any questions.